Okay, let's get started. Hello, everyone. Welcome to our second Sepsis Alliance Careholders meeting. My name is Savannah Stark. I'm the Vice President of Development and Operations, and we are thrilled to have, it looks like over 50 of you joining. That number is continuing to climb. Thrilled to have you joining us today to learn more about the work we do and how you can get involved. You can see our agenda on the screen now, and before we start, I'm going to go over quick housekeeping topics. Your audio is automatically muted. If you have any questions for the presenters during the webinar, please type them into the Q&A box on your webinar dashboard. We will try to get through as many questions as possible at the end of the webinar. And thank you also to those of you who have already sent in questions through the form. The webinar is being recorded and will be available on YouTube in the coming days. So to kick us off, I am pleased to introduce our board chair, Dr. Stephen Simpson.
Hi, everybody. My name is Steve Simpson. As Savannah says, I am a pulmonary and critical care specialist, and I work as a professor at the University of Kansas Health System. Welcome to everyone, and thank you for being here. As a nonprofit, we don't have shareholders, but we do have a lot of careholders, which are people like you who are interested in what we're doing and helping us to do it. So we're really happy to have you here. You know, I've been privileged to be the board chair for a couple of years now, and I've also been privileged to spend virtually an entire career working on sepsis in one way or another, either by research or by teaching or by helping hospitals to do a better job of recognizing and treating their sepsis patients. And so it's a real privilege to be able to work with folks like you and with folks like our leadership and staff that are on this call to fight the fight against sepsis. We're excited to tell you about our year. It's been a really good year where we have set strategies for ourselves in the areas of public awareness, where you all know us, in the areas of training medical professionals and nursing professionals, and you all know us as that, in the areas of advocating for sepsis patients with our legislative bodies, both at the state and the national level. And then a new endeavor for us is our promotion of seeking the actual cures for sepsis, which we have just really embarked on in the last year. It's been my privilege to work with everybody here, and I'm glad you were able to join us today. I think we have a lot of really cool information to share with you, so sit back and enjoy it, and we'll have some questions and answers later. Savannah, thanks.
Thank you, Dr. Simpson. Here are all of the presenters that you'll be hearing from today, and each person will formally introduce themselves during their portion of the presentation. And now I am pleased to introduce our Sepsis Alliance founder, Dr. Carl Flatley, to share more about his family's sepsis experience, founding Sepsis Alliance, and our Founders Legacy Society. Carl?
Yes, good afternoon and Merry Christmas. I appreciate you all being here today. And I want you to know, first off, I love this organization. The American Cancer, I've only got 5 minutes to share this with you, so I'll rely on some notes here. But the American Cancer Society started in 1913. Susan B. Komen was 1982, 42 years ago. American Heart Association, 1924. We started in 2007. In spite of the fact that sepsis is the third cause of death in the United States and the #1 cause of death in most hospitals. I wish we could have started earlier. The reason it was started is because I lost my daughter, who was 23 years old, went in for a hemorrhoidectomy on a Friday and died the following Monday. There were many mistakes made. The worst was they never gave her antibiotics for the infection she had following the surgery. And that's the key. It's the infection. You know, it's like, is the economy stupid? What's the infection? So here, this wonderful girl came in just for something in and out surgery. I was not concerned about it because I had it done myself, and she didn't make it. So the question is, why didn't they start sooner? Well, after it happened, I called around to see what was going on. CDC, NIH, no one was doing anything. So I started looking into forming the Sepsis Alliance. We had one sponsor when I started. I put in $100,000. Eli Lilly put in $100,000, and we're off to the races. We were small, we're very efficient, a good steward of monies, because I put in about half my retirement plan. When I lost Aaron, I committed myself to this organization, and I've been in it for 22 years now. I started, after I lost Aaron, I found a fellow by the name of Dr. Tracy in New York. And I said, he was a researcher. He said, well, there is no organization, but there are some people in Europe doing some work. So I got on a plane for the next 3 or 4 years, ran around meeting all these people. And then we started, that was in 2007, the Sepsis Alliance started. That's when Tom Heyman came on board, and that's when things turned around, because this guy's pretty special. I can hardly keep up with, well, I can't keep up with him, as a matter of fact. But he's run the organization. Savannah Stark, you met earlier, is the vice president, and we've done wonderful work. I had never heard the word sepsis when I lost Erin. And when I was at the bedside, when I was with her when she died, and she had a look in her eyes and said, can't you do something, Dad? And that's what's motivated me for the last 22 years. And I looked at the physician next to me like, I didn't understand what was going on. He said that there are lots of Erins. I couldn't believe it. Well, to show you how many there are, since she passed away in 2002, there's over 8 million people who have died in the United States from sepsis. There's over 13 million who have survived and got through it, but half of those suffered from physical and mental disabilities, cognitive problems. So this is a major issue. And evidently, as I mentioned, the doctors didn't know much about it either. This was in the early 2000s, and there were really no, I think some protocols, and Steve, you can correct me, I think protocols came out in 2001, the earliest protocols. But thanks to the work of Sepsis Alliance, we have them put in hospitals now. Most of them carry, I would say, more than half. Still, some don't. And they get fined if they don't follow certain procedures now. And you can thank the Sepsis Alliance for that. Not giving the antibiotic, so there is no real cure for sepsis, but we know how to treat it. And if you get in a timely fashion, and really this is important on the patient too, it's really your responsibility to recognize these issues at home. It's 87% of the cases of sepsis start in the community at home. So you need to recognize this. When I started, there's only 17% awareness. Thanks to this organization, it's up to 65. So again, what this organization done is just incredible. As I mentioned, I could have written the prescription. I did surgery every day for 20 years. I was an endodontist, and I never heard the word sepsis. And as I had said, 5 physicians didn't recognize it either. There were no organizations I mentioned, and at that time, I met a fellow in Germany when I was running around trying to learn something about sepsis by the name of Dr. Reinhardt, and he was in Germany. And I met him, and in 2010, we developed, along with 4 other organizations, actually we were the initiators, an organization called the Global Sepsis Alliance, which, now remember in 2004, there were no organizations. There are now over 110 organizations throughout the world that belong to that. And there's about 20 of them that call themselves the Sepsis Alliance, Sudanese, Japanese. So this little organization has really started something. In 2010, as I mentioned, we started the organizations, which right now I give awards from Aaron's Foundation for work done around the world to help recognize Aaron and things she's done. As I mentioned, Tom has led us for the last 17 years. And it's my mission now is to set a path to keep the organization going through the Founders Society, which I'll get back to. When I was getting ready for this, I looked at this. In the United States, We have lost 22 million people since Aaron died. 22 million. There's over 30 million survivors. And nationwide, we lose 350,000, and 11 million a year die. It's just in the 11 million a year worldwide die. So this is a terrible affliction. And it's all about the infection. And infection is preventable. 80% of sepsis is preventable. So based on the work we've done, Tom's going to share that with you. We've done remarkable work, and I couldn't be more proud. And I'm getting to a point in my life, I turned 81 next February, I'm getting on the back nine, and I've been in this for 22 years, so I don't want to quit. So what I'm trying to do now is, so you're going to lose your founder, but we need more. We've got a lot of work to do. We've only been at this for 13 years. So we need other people to join this club. If you wouldn't mind putting up the next slide, please. So I have already started this, and within the last year, we've had these other people join. And half of the people on there are on our board. We have a remarkable board of about 24 people who have given of their time and treasure. And now they've actually given gifts, planned gifts to the organization to keep it going for years to come. This year, along with starting this, I used Aaron's policy. I had given my children $1 million policies when they were very young, second to die. So when they get them, they'll be 50 years old or so, but it's kind of a safety net for them in case something happens. Death, it could be anything, but they've got those safety net. Well, without Aaron, I've given that over to the Sepsis Alliance to keep things going. And we have these other people now who have done the same thing. And I want to personally thank you and invite other people to consider this, because I met some remarkable people in my life. And one of the people I met was a dentist who said, you as a person, especially as a health professional, have ethical responsibility to be financially successful, because it's good for you and it's good for your patients. And once you have enough, and that's different for everyone, you have a moral obligation to be financially significant. And that's to give back to organizations, churches, things you believe in. So I will invite you, and we're going to talk later about if you want to work with an institution, our institution, that Savannah's going to cover that. But I want to thank you, and I can answer any questions when we get to that point. I'd now like to introduce our star, as Tom Heyman, who not only travels to Europe, but he just got back from France, has become a real hit in AMR, antibiotic resistance, which is a real issue in the country. So Tom, shine your light. Showtime.
Thank you, Carl, and know that we love you also, and so appreciate everything that you've done to get us to where we are today. Thank you so much, Carl. So here it is. There's Carl, there's Aaron. The reason we're here today, the reason so many have, been saved, is the work of our founder, and led to us becoming the first patient advocacy organization in the country, and by all measures, the leading patient advocacy organization in the United States. And as Carl mentioned, we thought, this needed to be addressed globally. So we co-founded the Global Sepsis Alliance in 2010, and that's really taken off. And we have really worked hard to become a trusted partner to our patient community, to healthcare professionals, researchers who are so important, government agencies, and industry partners. And our mission, which we updated recently, is to save lives and reduce suffering by educating the public and leading an alliance of patients, healthcare professionals, and partners committed to preventing and curing sepsis. So big ambitions here. And what this looks like ultimately is a world in which nobody is harmed by sepsis. And you can see here, these are our ratings these are the organizations that rate charities based on how efficient they are with their use of funds and how transparent they are in the way that they operate. And you can see that we have top level ratings from all of those organizations. Next slide. So here's something we're very proud of, developing this mnemonic. And as many of you know, Stroke developed the FAST mnemonic, which has been incredibly helpful for folks to understand the need to seek care urgently when they have are experiencing in themselves or a loved one certain key symptoms. And so we developed a TIME, which is a nice mnemonic because time is so important. It's so critical that if you're becoming septic, that you seek care and get care quickly. So the T stands for temperature, which can be higher or lower. Infection, signs of infection, which can be a number of different things, visual or something like painful urination, or an inability to urinate with young children or even adults, we've heard. A mental decline, often a clincher when it comes to the ability to diagnose early, is they're just not themselves. And then extremely ill. We hear people say it's the worst pain they've ever had in their lives, and they felt like they were going to die. And as we know, sepsis is not an infection. It's a life-threatening emergency that happens when your body's response to an infection damages your vital organs and often causes death. Next slide. So we operate in 4 specific areas. We started in area number 1. Carl mentioned that when he got started, when we lost Aaron, awareness in the country was less than 20% of people even having heard the word sepsis. Hard to believe. But also at that time, Microsoft didn't have the word in its dictionary. So sepsis was a spell check error just 20 years ago. So how we're addressing that is we have, I hope all of you have been to sepsis.org. We're getting over 2 million visitors to our website each year, which really tells you a couple of things. One, that it's a good website. It has a lot to offer. And that also there's a rising interest and a concern and a knowledge about the impact of sepsis, which is leading for people to find out more. So we have lots of resources there. You'll also be hearing about our survivor community in a few minutes. And then our second pillar is making sure that our healthcare professionals know as much about sepsis as they know about stroke, so that when we go to seek care, that it's on their radar and they're going to provide the care that we need. So you'll be hearing more about that operation in a couple of minutes as well. And then the third pillar, making sure our elected officials really understand that this is the #1 cost of hospital care. This is taking 1 in 3 people who die in a hospital are dying of sepsis. So it's taking their constituents, it's costing a tremendous amount of money. It is a very bipartisan issue. And we're always out there on the state and federal level, making sure that our elected officials understand that. And then research and innovation. We don't have all of the tools in place to really effectively prevent, diagnose, and treat sepsis. So we're actively working with our industry partners and research partners to make sure that they have everything they need to help make sure that those innovations are available to us at the bedside. Next slide. So this is where I think I turn it over to Megan.
Thank you so much, Tom. I'm Megan Jones. I'm the Senior Community and Content Manager at Sepsis Alliance, and I'm really pleased to be with everyone today as I have an opportunity to talk a little bit about that first pillar that Tom mentioned around public awareness, education, and support. This first slide really talks about the public awareness and education piece. And some highlights from this year that we wanted to share with everyone here today. The first is that we reached a really big milestone in our Faces of Sepsis community. We've published now more than 2,000 Faces of Sepsis experiences on sepsis.org that many of you have been gracious enough to share with us. And these are stories of people from all different walks of life, background, locations, all of that, that have either had sepsis and survived, or tribute stories of folks who were unfortunately lost. And that's a really just an important resource for getting the word out about the different ways that sepsis can appear and the different kinds of effects it can have on lives after that experience is behind someone. We've also, this year, we're really proud of refreshing our Sepsis and library on sepsis.org. It now features resources on 79 topics related to sepsis, everything from pneumonia to cancer to pregnancy and childbirth. And I really encourage everyone to take a look at that collection to find out what information exists there that might be helpful to you or to folks you know, either in a personal or professional capacity. We also launched educational campaigns on a variety of topics this year, including influenza, pneumonia, athletes, home infusions and dialysis, school nurses, and more. And finally, last thing we wanted to highlight is that we began a program to equip sepsis survivors and caregivers to begin to contribute as patient partners in research. So in the design, conduct, and dissemination of research studies, rather than just as study subjects. And so that project, or at least the first cohort of that project, will conclude in 2025. And we're really thrilled and excited to see the contributions that all of those folks will make to future research. Next slide, please. And then secondly, Sepsis Alliance Connect, we thought really deserved its own separate bit of attention here in this program. This is our virtual support community for everyone who's been personally impacted by sepsis. We just welcomed in November our 3,000th member. So we've been around for just over 2 years now, and already in that time, our community has grown substantially. And we're able to offer regular live support programming for survivors, for caregivers, for those who've lost loved ones, as well as other maybe more specific groups like amputees, young adults, and those who lost a child. So we're offering roughly about 13 programs like this per month. We've also added 19 new educational programs to the program library. So these are more webinar style programs, and they're on a variety of topics, whether it's on life after sepsis or highlighting resources for folks who've had amputations. And those are available live, but also, as we alluded to on this slide, they become enduring content in that program library. So they're available whether, whenever you join the community or whenever you would like to view them. And then finally, another thing we wanted to highlight from this year specifically is that we moved to a new platform in 2024, which allows us to really enhance what we're able to do. So in addition to live and recorded virtual programming, we're also able to offer things like discussion boards. And so it's been really amazing to watch new connections grow using that tool as well. And then last thing on this slide to highlight is really just this quote that somebody provided on a recent survey. They said, discovering Sepsis Alliance right after being discharged from the hospital was life-changing. And they specifically called out connecting with others as being crucial to healing mind, body, and soul. And that's something, we see time and time again, is that the most important thing that we here at Sepsis Alliance Connect provides is really that ability to find others who've had this experience. Having sepsis is not rare, but it certainly can feel isolating. And so being able to break down those walls of isolation is something really powerful, and something I'm really honored to be able to play just a little bit of a part in. And then with that, I think I will pass it to my colleague, Claudia, who will speak to our provider education and training piece.
Yeah, thank you, Megan. Hello, it's great to be here with everyone today. I'm Claudia Orth, the Director of Professional Education and Training with Sepsis Alliance. I'm here to tell you a little bit more about our healthcare professional education and training pillar. Sepsis Alliance Institute is Sepsis Alliance's free community of over 50,000 plus healthcare professional members from across the continuum of care, covering quality, patient safety, critical care, med-surg, long-term care, home care. We have nurses, physicians, pharmacists, advanced practice providers, industry, and others. The membership makeup is mostly US-based, but also includes international healthcare professional peers and colleagues. We have the privilege of working with over 275 leading subject matter experts in infection prevention, healthcare-acquired infections, antimicrobial resistance, and of course, sepsis, that generously, I should say, lend their time and expertise to provide help, high-quality education and training for Sepsis Alliance. We really couldn't do what we do without these partners. Next slide, please. Many of you may already know this, but Sepsis Alliance Institute offers members live and on-demand continuing education and sponsor-led learning opportunities. We have a very active peer-to-peer discussion And newly, we started it this year on World Sepsis Day. We also offer monthly virtual open forums for networking and resource sharing, as well as a pretty robust resource library and downloadable resources covering everything from sepsis coordinator job descriptions, sample sepsis charters, protocols and policies, escape room materials, and lots more. Members do have to create a one-time free account, which then gives access to all of Sepsis Alliance Institute's offering and allows each member really to tailor their profile to receive either a real-time notification when new posts are being made or a weekly digest on current discussion and events that are happening within the community. Next slide, please. This year, we once again hosted two very successful virtual conferences, the Sepsis Alliance AMR Conference in the spring and the Sepsis Alliance Summit, which is always hosted in September during Sepsis Awareness Month. We also provide year-round CE and sponsor innovation webinars, and as well as symposia. And I'd encourage you all to join us for our last Sepsis Alliance Symposium of the year, scheduled for next week, December 12th, on healthcare-associated infections. And we can drop the registration link for that in the chat here in a minute as well. Next year, we are also super excited to be releasing a brand new 9-episode podcast series supported by funding from a Pfizer grant, which will allow learners to take advantage of a more mobile and audio-focused learning medium. And lastly, and I apologize for not having it listed here, but also wanted to let you know to be on the lookout in early summer of 2025 for a Baxter grant-funded new 5-module on-demand sepsis fundamentals course. This is going to be an incredible educational resource, not just for individuals, healthcare professionals, but also for healthcare organizations looking to educate their staff. The Sepsis Fundamentals course will also be a great resource for anyone who's considering taking and or studying for the American Association Critical Care Nurses Sepsis Micro-Credential, which just got released this year. So lots of exciting things happening. I encourage everyone to join. And as I mentioned, consider signing up to join us for next week's Healthcare Associated Infection Symposium. And with that, I'll turn it back over to Tom. Thank you so much.
Thanks, Claudia. Amazing, amazing work. A newer area for us, but one that has really been very, very impactful is in policy and advocacy work. And we have our Sepsis Alliance Voices program. And we've had over 1,500 advocate actions taken this year, meaning folks have contacted their governor, senator, congressperson, et cetera, to speak about the need for more response on sepsis. So these are real, great opportunities for individuals to, put their voice forward and have a real impact on sepsis regulatory and legislative initiatives, both state and federal level. What we do to support these folks is we offer advocacy trainings, and we offer these about once every quarter, which really gives the opportunity for advocates like you to be really, more confident and better informed on key issues, so that when they speak to the media or their congressperson or senator, which is happening all over the country, there's much greater impact on that conversation. So that all led together this year during Sepsis Awareness Month. We had a Hill Day on Capitol Hill, which meant that we brought advocates in from all over the country and had meetings with senators, congresspeople, et cetera. You see the picture on the right, that's me. Second from the left was Senator Ossoff from Georgia. And he was interested in what I had to say about sepsis. I had all the numbers and facts and figures, but it was Kimberly Emanuel, who's second from the right, telling her story as a Georgia resident, having had multiple amputations as a result of sepsis, that really, caught his attention, obviously. And he ended up giving all of us his personal cell number. We're in touch with his staff now. He really wants to do things that can be helpful. And that's Kimberly's husband next to her, who's just a wonderfully terrific man. So that was a very exciting event. We hope to do it again next year. We were also very involved in the state of Maryland, working with a family there that lost their 5-year-old son, Lachlan. Really a tragic story, but one that's, unfortunately not uncommon. Lachlan was sick enough that the parents took him to their local urgent care. They were worried about him, and urgent care's diagnosis was that it's probably just the flu, and keep him hydrated and he'll be fine. And Lachlan passed away 12 hours later at their local hospital from sepsis. So the DeSantis family put together a couple of things. One is a flu vaccine van that drives around Maryland to provide free flu vaccinations. But also they put together basically the content of a law, Lachlan's law, that they wanted to happen in Maryland, which would require every hospital in the state to have a sepsis protocol in place for patients of all ages, and training and education in place for the staff. Excitingly, it also includes urgent care, so that every urgent care in the state of Maryland has to have a protocol to know when to refer a patient to the hospital, and also training and education behind that. So we were active. We testified in Annapolis, met with senators and assembly people, and we were there. It was really a great event for the signing of this law by Governor Moore. So real impact, and working collaboratively with folks in the state, our organization. It was really a team effort that helped pass that really critical law now for the state of Maryland, which we hope will replicate in other states. Kentucky has now expressed interest in doing the same. And then also very exciting is that, we know survivorship is a big issue, and there has never been a diagnosis code for post-hospital sepsis care, whether you call it post-sepsis syndrome or any of the after effects that might be present in a patient after being hospitalized, very often in the ICU. And we know that there are really, significant issues coming out of an ICU experience for the patient and family members. So we were able to work with our partners at the CDC and the University of Pennsylvania and some other partners to encourage the CDC to develop an ICD-10 diagnosis code for post-hospital sepsis care. So what this means now is that clinicians can actually record the work they do for sepsis patients, and they can also get reimbursed, which is really, really important. So we're hoping that this is really going to provide a huge level of support for patients in hopefully preventing rehospitalizations and also alleviating a lot of the concerns they may have. They'll actually be able to get better treatment as a result of this. So very, very excited about the impact we've had this past year. Next slide. And another new initiative, really focusing on it's 70% of sepsis cases are in folks 60 plus. Unfortunately, now that I've reached that threshold, we decided that it would be important for us to really put a focus on sepsis and aging. And we have started what is now called the Partnership for Sepsis and Aging. It is a partnership with the New York State Office of Aging, an organization we've been working with for many, many years, the Home Care Association of New York State, and the Association on Aging in New York. We've had 2 meetings thus far. The first meeting had 40 people attend. The second meeting had 200. And we now have representatives from 13 different states participating in this initiative. The goal is to get all 50 states participating so that all of the information we have available for the public, for patients, for healthcare professionals, policy issues can get disseminated out across the entire country. We actually have our next meeting tomorrow. So the focus is here on bringing organizations together who can then help disseminate information and also provide feedback to us. So if they need information in Spanish, or if they need it for intellectually disabled adults or children, we'll get that feedback and we can develop those materials so that as a country, as an entire partnership, we can hopefully help protect the lives and well-being of our older adults. Next slide. And giving it over to Alex Colvin.
Hi, hello. So I am the Sepsis Alliance Director of Marketing and Communications, and I just wanted to share our recent sepsis awareness survey results. Every single year, Sepsis Alliance does a survey of a census reminiscent population in the United States, and this year, sepsis awareness, or awareness of the term sepsis, has reached 69%. That's up from 65% last year, and we are so happy to see these numbers growing, but of course, that is still not 100%, so we still have a ways to go. Next slide, please. I just pulled out a few stats from that as well. 77% of people do not believe or do not know that the flu can progress to sepsis, which is also a big piece for us to continue educating on. 82% do not believe or do not know that vaccines can prevent someone from getting sepsis. We know infection prevention is sepsis prevention, and one of the best ways to prevent infections is through vaccines. So that's another piece for us to continue educating. And then those who identify as white are still significantly more likely to be aware of the term sepsis than those who identify as Black or those who identify as Hispanic. So we still see a lot of disparities. And that is something also that we are working really hard to close to make sure that we are creating as equitable, as much equity as we can in the healthcare space. Next slide, please. So we also have recently launched our Sepsis Alliance Ambassador Program. Sepsis Alliance is pleased to work with individuals in the public eye with a national or international following. These public figures promote Sepsis Alliance's mission and values, helping us to raise awareness and support. And we are so excited to welcome WNBA player Tiffany Mitchell as a Sepsis Alliance ambassador. She survived sepsis from an appendectomy in July, I believe it was, and she's going to be working with us to spread awareness over the next year, especially during Sepsis Survivor Week. We are so thrilled that she is doing well after her sepsis experience and has chosen to work with us, and we are really excited to share more about that into the future. Next slide, please. And then I just wanted to remind everyone as well, Sepsis Alliance is on social media. We're on Facebook, Instagram, YouTube, LinkedIn, and X, formerly Twitter. We are Sepsis Alliance on all of those channels. Our logo will be there as well. So I encourage you to follow along. It's really the best way to get our up-to-date information on what is happening with Sepsis Alliance, and to make sure you know all of our happenings and goings-ons. So thank you so much, and I will pass it to the next person.
That's me again. Thank you, Alex. Yeah, there's, as you can tell, there's a lot happening, and all of you, I'm seeing in the chat a lot of interest in getting more involved with the organization. That's fantastic. Everyone can play a role. There's a role for everybody in sepsis. It is such a big issue. It needs so much work. And as Carl mentioned, we're in our 18th year, and for some of us that seems like a long time. We should have fixed this already, but when you put it in context to cancer and the other organizations, there's still a lot for us to do, and with your help, we'll get there. So looking ahead, a lot of exciting things already on the boards for next year. We'll be launching a vaccine awareness and education campaign. We'll be doing that through out-of-home billboards in select markets in the Southeast. We'll be participating in and supporting new sepsis quality improvement measures. We'll be working with the CDC and other organizations, CMS and others, on these. One is on a sepsis outcomes measure, which will track mortality from hospital to hospital. So we'll get more transparency on hospital performance, which will be great for folks to be able to see how their hospital is doing versus others. There's also work being done on a sepsis structural guidance measure, which relates to this new CDC Core Elements program, which is really a guide for hospitals to do better on sepsis. So rather than just give them a handbook, there will actually be a measure to track how well hospitals are performing against that program. And then third, really exciting, is a sepsis readmissions measure, which will add some real, insight and transparency and tracking to how hospitals are doing, not just on mortality, not just on death rates, but on how people are doing after their care. It's a big issue, and we're seeing more and more as we learn more and more about sepsis, that it's not necessarily whether you live or die. Obviously, that's critical, but a lot of folks have difficulty getting back to work. There are many folks who require readmissions, and we really need to give more of a focus on, the quality of life after a sepsis event. We have big plans for Sepsis Alliance Connect. I think Megan's going to do this without breaking too much of a sweat. So I'm expecting to see more than 4,000 members of our Sepsis Alliance Connect community as word starts to get out that this is a really valuable community for the millions of sepsis survivors and their family members across the country. On the healthcare professional training side, I don't think Claudia mentioned this, but we are well on our way to securing ACCME accreditation. And what this means, not everyone knows what that means, but it will allow us to offer not just continuing nursing education credits, which we do now. We're accredited by the California Board of Nursing, but we'll be able to offer continuing medical education to physicians and other providers as well. We're hoping to have that in place by the end of the second quarter. Our Sepsis Alliance Institute community, which has been growing at about 1,000 new healthcare professionals each month, we hope to reach 65,000 by the end of next year. And then we're also doing a lot of work on the sepsis.org website. Megan's leading the work on this, really to facilitate navigation so people can find what they want to find more easily. And, really creating an interconnectedness between all of our communities, all of our pillars, all of what we do is so, doesn't belong in silos. It really belongs to be interconnected across the work we do and the people we work with. And then we're also looking to expand patient advocacy opportunities. As you saw, there are a lot of things happening. There are a lot of bills and legislation and regulatory things that we as a very, very strong and well-regarded patient advocacy organization can have impact on. And really what it all comes down to for us is, our continued mantra is to serve the needs of our patients and families. And I thank all of you for being here. It's an amazing turnout today. So the chat is on fire, and I'm going to turn it over to Savannah.
Thank you, Tom, and thank you everyone for sharing all of your amazing updates with the group. I'd like to share just a little bit more about the ways that you can get involved with Sepsis Alliance. I see a lot of you really interested, and that's fantastic. So our programs are powered by community. Please do join us for any programming that you are interested in, and invite others to join you as well. So for example, if you are a sepsis survivor and participate in Sepsis Alliance Connect peer support conversations, perhaps you'd like to invite a loved one to participate in the support conversations for caregivers of sepsis patients. Our healthcare professionals, please do also share Sepsis Alliance Connect as a resource for your patients. That would be amazing. And then engage with us on social media. Alex shared all of our social media accounts earlier. Each time that you like, comment, or share our post, it increases engagement and reaches more people who need to know about sepsis. So please continue doing that, and thank you. And then, of course, we can't get through this presentation without talking about different ways to give financially. We offer several ways to give for sepsis education, awareness, and advocacy initiatives. We also understand not everyone is in a position to give. So, doing whatever you can is very much appreciated. You can make a one-time or a monthly gift at sepsis.org, and you just click donate at the top. We also do accept gifts of stock, gifts through donor-advised funds, and also through IRA rollovers. I'm happy to answer any questions about that. Please feel free to reach out to me individually. And then, as Carl mentioned, join our Founders Legacy Society and make plans to include Sepsis Alliance as a beneficiary of your estate. Again, we are truly grateful for everyone who participates in any of those options. Please feel free to reach out to me. And then also, we do have a volunteer interest form. We will put that in the chat, and it just gives you an opportunity to share more about the ways that you would like to be involved. So we know all of your preferences, if you'd like to participate in surveys or focus groups, or share your story with the media or with industry. We get a lot of people that reach out to us asking for speakers. So if you complete that form, we will have all of your information and be able to reach out to you when opportunities arise. And then finally, there's my contact information. Feel free to email me at any time. You can always reach out. And before we move on to questions, I would like to take a moment to recognize some of our Carl's Champions Giving Society members that are shown here. These generous supporters are recognized for contributing $1,000 or more a year to help save lives and limbs from sepsis. And their support is critical to maintain and grow all of our amazing programming. So thank you so much to those of you on the call today. And with that, I'm going to stop sharing my screen, and Alex is going to lead us through the Q&A portion.
Yes, thank you so much. And if you have any other questions, please feel free to enter them in the Q&A section. So one question to get us started, and this I believe will be for Tom, though others can jump in, of course. What is the status of Lulu's Law as sponsored by Representative Mickey Sherrill for the purpose of establishing a legislatively mandated sepsis protocol standard? I don't know that we touched on Lulu's Law too much during this conversation, but we definitely have a lot to say on that.
Yeah, and for those who don't know, Lulu's Law is named after Lulu Haynes, who's 4 years old from neighboring town of mine in New Jersey here, and she died of sepsis result of an appendicitis. And Mikey Sherrill, who was congressman of that district, heard about the story and reached out to the family. Lucas is the dad who's now on our board, and really wanted to be helpful. So Lulu's Law is two things. One, it is about the creation of a data registry, kind of like the cancer registry that's been so helpful in helping us understand cancer and the many types of cancer, working with the CDC. That's one component of Lulu's Law. And the other is to create a national sepsis action plan. As you may all know, getting things through Congress in these times is very challenging, but we're not giving up. We introduced in the House of Representatives, bipartisan, Mike Sherrill and Larry Bouchon, a Republican from Indiana, brought it into the House of Representatives. We had more of a struggle in the Senate, finding a Republican senator who would work with Bob Casey, who is our sponsor lead in the Senate on the Democratic side. Our plan is to reintroduce Lulu's Law next year. We're doing a lot of groundwork. We're researching all of the newly elected Congress people and senators. There are many doctors in the group, so we're really going to go at it hard and reach out to those offices and engage all of you who live in those districts to reach out personally, because there's nothing like hearing from a constituent, from a voter, for these folks. You know, the story I told earlier about our event with Georgia and with Senator Ossoff. It's really important that we find people in each district who can talk with us to these folks to get them encouraged to participate and help support Lulu's Law. So it's hard to do hard things, but it took over a decade for the cancer registry to get started. So we believe this is really important work, and with all of your help, we're going to make it happen.
Great. Thank you so much, Tom. So our next question. So somebody mentioned being a sepsis survivor myself, as well as the mother of a child who has now survived sepsis. I would love to advocate for better monitoring once a survivor has been discharged from the hospital. And then does Sepsis Alliance have any resources around caregivers and advocating for that? So I think, Savannah, would you like to take this one, or Megan?
Yeah, probably Megan.
Yeah. It looks like she's trying to find the unmute button.
I was trying to find that. I was trying to find the question so I could read. I was having trouble capturing all the details orally. Is it in the Q&A box?
About support resources for survivors.
Gotcha. Yeah, I could definitely answer that piece quickly. Sepsis Alliance Connect is the best place. That's sort of the central location for support resources for survivors. So the best way to get there is to go to sepsisconnect.org. I know Alex put that in the chat earlier. And from there, we're happy to sort of relay you to various, whether it's live support conversations, whether it's discussions with other survivors, whether it's printed resources and things like that, that we can find either on our website or referring out to outside resources and places where there are complementary resources that other organizations provide.
Yeah, and on sepsis.org, you'll easily find an area called Life After Sepsis, or post-sepsis syndrome, and you'll find vast resources there, videos about the post-hospitalization experience, et cetera.
Specifically, I would just add too, we also have a resource that is a red, yellow, green resource that can be helpful for patients after they're going home and for their caregivers, that kind of shows zones on signs and symptoms to look for that might be concerning. And again, that's available through sepsis.org also.
Great, thank you so much. And then we have another question that just came through in the Q&A. Do all states have some type of sepsis protocol? I know some states do. Tom, would you like to take this question?
Yeah, some do. There's also a national protocol that we've been very involved in called SEP1, which requires any hospital that is a Medicare hospital, which is almost all of them, to have a sepsis protocol in place. And that's called the SEP1 measure. That upon suspicion of sepsis, they have to take a blood culture, start broad spectrum antibiotics, start fluids, take a lactate measure, and then repeat those on a certain schedule. So we were very active in fighting for the reauthorization of that. Some of the hospital associations were not so keen on having this requirement, but we know that it saves lives. And Dr. Simpson here was part of study work that proved that it saves lives, as many as 5% difference, I think it is. And not only did that act get reauthorized, but it's now part of value-based purchasing. Again, something that we fought for. So hospitals are not only going to have to report on that protocol, but they will be financially penalized or incentivized based on how well they do. And that's going to start, I believe, at the end of next year. So we're very, very excited about that. On top of that, certain states have enacted, statewide protocols, including New York, Rhode Island, now Maryland with Lauchlin's Law, Indiana, Illinois, Kentucky's interested in doing it. But they're all a little bit different, and they all have certain opt-outs, and some don't have a financial component. So it's a little bit of a mixed bag there. Some states do, some states don't.
Great, thank you, Tom. Next question. Somebody posted, I'm new to the organization. Are there guidelines or a group in your organization that works with pre-hospital medical providers? I'll send this over to Claudia.
Yeah, thanks, Alex. Yeah, we absolutely do have information available on pre-hospital. We have a couple of great on-demand courses available through Sepsis Alliance Institute. So if you become a member, if you aren't already, on the left-hand side, there's a drop-down that shows categories, and you can click on pre-hospital categories, which then should lead you to a page that outlines courses. We have a sepsis first response course, for pediatric first response course. We also have a disaster medicine. And then last year, Ram Duckworth, who is a pre-hospital EMS provider who's on our advisory board, gave a great presentation on pre-hospital sepsis care research update. So I would encourage you to check that out.
Great, thank you, Claudia. And then another question, this one will also go to Claudia. Is there any intent to have a certificate only in sepsis?
Yeah, great question. So I mentioned when I was presenting that just recently the American Association of Critical Care Nurses put together a micro credential for sepsis that is available. There's also a hospital certification currently that can be obtained through the Joint Commission. As far as Sepsis Alliance, we don't have a certificate right now, but there is for each individual course that you take. You do get a certificate for continuing education or a participation credit that shows that you've, educated yourself on that specific topic. And then, of course, there'll be a certificate. I mentioned the sepsis fundamentals, which will sort of be a way to indicate that a basic sepsis understanding is available. One other thing that we just recently added is we have a badge available that can be added to our signature line that shows that folks are a member of Sepsis Alliance Institute. So those are kind of the current means of certification and to show sort of competency and education in sepsis. Hope that answers the question.
Great, thank you. So another question. What are the conditions in which people are at risk to develop sepsis? Are UTIs a possible risk? Are open wounds or any break in the skin a risk? Dr. Simpson, would you like to talk more about some of the risk factors?
Yeah, risk factors for sepsis are, well, there are myriad. We'll talk about that. There are those things that happen to normal people, just as you just mentioned, such as open wounds, such as appendicitis, such as surgeries that seem to be routine and yet go awry because of contamination of a wound or contamination. If they're intra-abdominal surgeries, of course, you can contaminate the abdomen that way. One of the biggest risk factors, sad to say, for people my age is getting older. We know that over 50%, perhaps as much as 75% of cases of sepsis occur in those of us who are over age 65, and that the way I think of it personally is that just like all the rest of my body parts are getting older and worn out, my immune system is doing the same thing. at the same time. And so that's one thing. People with chronic diseases of all sorts who have to take immune suppressing drugs. People with diabetes have immune suppression that naturally occurs as a result of diabetes. People who have conditions that require them to be admitted to the hospital with frequency are exposed to the hospital environment and the bugs that are there all the time. And then, of course, what we're talking about with everything that I've said is the risk of acquiring infection. We do know that there are certain things that are not well described yet, but there are genetic predispositions once you get an infection that some people are more likely to have it progress to sepsis than others. But that sort of research is actually in its infancy. I hope that got to one key place that I would be remiss if I didn't mention was the area of cancer and chemotherapies and drugs that suppress the immune system in order to treat cancer. That is another major risk factor.
And amazingly, and Steve, you know this because it shocked me, it can be as simple as a mosquito bite, a tattoo gone bad, diaper rash. It's any infection. It's incredible. It's incredible.
It absolutely can be.
Great, thank you so much. And we have more information about that as well at sepsis.org. I encourage everyone to go to the site and check it out if you have any questions, or also email us at info@sepsis.org for more information as well. So I think we have time for one more question. Somebody said, I am getting ready to redo and update our company website. Can we use sepsis.org materials and logos? So I would love to take this question. We have some logos and materials that you are welcome to use in their fully unedited state. We have a time card that has information about TIME as well as how to get more information, and that can be used in its full unedited state. We do not allow the Sepsis Alliance logo to be used as an individual piece on different websites or materials. And anybody who has questions about branding or what materials they may or may not use, you're welcome to reach out to me. My email address is a.colvin@sepsis.org, and I can walk you through a little bit more about what materials are good for using, and also make recommendations as well, depending on what you're trying to create.
I will just add to
ahead.
that quickly. Alex puts together an excellent Sepsis Awareness Month toolkit each year. So I know we're past that this year, but as you think about planning for next year, please do use the toolkit. There's graphics, there's all the terms of how you can use it, just a ton of free resources. So definitely use that.
Yes, and that can be found at sepsisawarenessmonth.org. Very.
And we didn't mention our other observances coming up in February. We have Sepsis Survivor Week. In April, we have Pediatric Sepsis Week, and in May we have Maternal Sepsis Week. So look for news coming out about those real soon.
Yep. All right. Well, I think we're just about at time, unless we have any last pressing questions. I think that was the last one, though. Is that right, Alex? Okay. Amazing. Well, thank you again for attending today's webinar. In a moment, when we close the webinar, you'll see a survey pop up on your screen, and we would certainly appreciate your feedback. Please reach out to us with any questions. I put info@sepsis.org if you have a general question, and then we have all of our individual email addresses as well. And we hope to see you at future Sepsis Alliance events. Thank you so much and have a great rest of your day.
Thank you.
Take care, everybody.